Hello Brain Shakers, Brave Alice is here from the Brain Shakers Academy with yet another exciting topic called placenta previa. So in today's session, we want to look at some of those forms and grades of placenta previa, or where the placenta normally may be situated. We must also make mention before we get into it that the placenta tends to implant itself in the upper uterine segment, and that's the most favorable position for a placenta to implant, not only because that is where you find a larger surface area, but that is also where the uterus tends to be supplied with a good nourishment as well. Now let's get right into it and see the various forms of placenta previa. So right here with me, I have drawn 4 diagrams here that are going to help us in understanding what a placenta previa is. So you have a uterus here and you have a placenta in each of them, and then what you see protruding on the bottom end is actually the cervix. Now as we look at the this whole session, we need to also make mention that the cervix has what is known as a cervical os. It has an internal os and an external os. So we're looking at this particular end here as the external os, and then there is a canal. It's like a canal in between, and then we get through to the internal os, which is right around this region. So you have an external os and you have an internal os, and then you have that canal, which is usually about 2 to 4 centimeters in length. And once the woman gets into labor, then it reduces and then it will proceed as such. So there are various forms of placenta previa. So once a placenta has inserted or implanted itself into an area that is no other than the upper part of the uterine segment, then it is considered to be a low-lying placenta. So it means that that placenta inserts and implants itself into the lower portion of the uterine segment. And if you look at this first diagram, you will notice that the placenta has invaded the endometrial lining in the lower bottom. If we were to take this as the half of the uterus, then you will note that the upper uterine segment is left open, and then the bottom uterine segment here, which you call the lower uterine segment, this is where now the placenta has gone on to implant itself. So this is what we are going to call a low-lying placenta. Okay, so this is a low-lying placenta. So this placenta is just in the lower part of the uterine segment, but then does not reach the cervical os. And it is also known as grade 1. This is grade 1 placenta previa. Now, when you come to the second one, you notice that the placenta is also inserted in the lower uterine segment, but then reaches the margin. It reaches the margin of the internal cervical os. So this one is now going to be referred to as marginal because it reaches the margins of the cervical os. So this one we are going to call it marginal. And it can also be referred to as grade 2 of placenta previa. And then we got to the third diagram here, which obviously goes through the cervical os, but does not completely cover the cervical os. It is just partially covering the cervical os. And because it is just partially covering the cervical os, it will be referred to as a partial placenta previa. And so this one will be called partial. And because it is a partial one, it will also be referred to as a grade 3 placenta previa. Now, there are certain times when this whole placenta decides to just sit on top of the cervical os and cover it in totality completely. Then you refer this to as a complete placenta previa. Okay, so that will be a complete, and can also be referred to as a grade 4 placenta previa. So you have grade 1, grade 2, grade 3, and grade 4 placenta previa. Now, having looked at the different forms of placenta previa, What then are the risk factors for a placenta previa? So you must note that people that obviously use cocaine and cigarettes or smoking, they are at higher risk of developing a placenta previa. People that have had more babies also are at higher risk of developing a placenta previa. And people that have had miscarriages and abortions as well and ended up having a D and a C, which is just dilatation and curettage, then the healing process happens by fibrosis or scarring, then they may be predisposed to ending up with a placenta previa. And people as well that have had any uterine surgery or cesarean section deliveries, then they are more at risk of developing a placenta previa. You also take note that those that have multiple pregnancies, that is having 2 or more babies, increases the chances of you developing a placenta previa, because the placenta is going to be a very big placenta that will then encroach into the lower uterine segment. Now, this whole process or this whole abnormality of placenta previa can then be identified through scans, and it can be detected through scans. When you do a scan, you will be able to note on whether the placenta is an anterior placenta, is it a posterior placenta, and when you have noted whether it is anterior or posterior, you will be able to grade on whether it is a complete placenta previa, is it a partial, or is it a marginal placenta previa, or it is just a low-lying placenta. Now, in the first few weeks of gestation, you notice that the placenta can be low-lying, but as the pregnancy then continues, as you go towards term, you find that the placenta then slightly moves off the os, and the os is then free. So you start looking at this particular woman that comes in with a low-lying placenta, put them on serial scans, and see as well and the detachment, or rather the movement, how much distance is going to then be created away from the os, to see if the labor process can be allowed to culminate into a normal delivery. Otherwise, if they come in and they are presenting with some bleeding, the forms of management that you can actually put in could be, one, to admit them and continue to monitor them and see if the bleeding is going to be torrential, or is going to then later stop. And then if you notice that the bleeding is persistent or is continuous, then you have another option of obviously allowing them to abstain for the rest of pregnancy. That means no sexual intercourse, because that has the capacity of also causing further bleeding. And when they have a placenta previa, you also notice that it is another indication basically for it may culminate into a preterm delivery, because the chances of you going for an early delivery prior to 37 weeks are higher. As long as the placenta is in front of baby's head, you're not seeing that baby coming out, because the chances are that it is attaching in the segment of the uterus that is poorly nourished, and the more nourished side is usually the upper part of the cervix, and you want this particular baby to be able to grow and reach term. Once it is in the lower segment, the chances of a preterm birth are higher, depending on how much bleeding that the woman is going to present with. So that is basically placenta previa. You have 4 grades: a low-lying placenta, then you have a marginal, then you have a partial, and then a complete. If you have a complete or a grade 4 placenta previa, don't even think about a vaginal delivery. You just think of things to do with a cesarean section, because once the placenta then detaches prior to the baby being delivered, you end up with a fresh stillbirth. It is a little bit debatable on whether you can have a partial placenta previa culminating into a vaginal delivery. It may culminate into a vaginal delivery, but the chances also of a postpartum hemorrhage and a fresh stillbirth here are kind of very high. If you have something that is marginal, it's a little bit negligible, but look at how far the placenta would have moved from the cervical os for you to determine on what would be the best option of a delivery. So basically, that's about the placenta previa. And if you found this particular video helpful and interesting, do give me a thumbs up and Drop me comments in the comment section. I'd like to hear what you think about it. And don't forget to subscribe. And thank you so much for watching. And as always, I will see you in the next one.